My name is Dr. J.K. Jameel. I'm a senior consultant in the Department of Surgical Gastroenterology and Minimal Access Surgery at Apollo Hospitals. The term hernia is a familiar term for many, but not many are aware of the exact reasons as to why hernia develops, what sort of symptoms it causes, and what sort of treatment modalities are available. Over the next few minutes, we'll try and discuss some of these, and I hope you will find this video beneficial. Hernia is basically a defect or a gap in the abdominal wall, and through this defect, the contents of the abdominal cavity, such as the bowel or the fat, we call it as omentum, comes out and protrudes and causes problems. There are different types of hernia. If the hernia occurs in the groin, it goes by the name inguinal hernia. If it happens around the umbilicus, it's called a parumbilical hernia. If it happens quite higher up in the abdomen, in the epigastric region, we call it as an epigastric hernia. These are some of the names that we give for different types of hernias. There are many more. In addition to these hernias, which we can group as abdominal wall hernias, there's also another set of hernia such as hiatus hernia and internal hernia. Now these are entirely different entities, and we're not going to be talking about them today. Rather, we would be focusing only on abdominal wall hernias. The most common symptom that patient has when he develops a hernia is a lump. He often comes to the doctor complaining of a lump. In addition to that, he or she could also have a dragging sensation or occasionally pain, particularly when they are standing for a long time or straining or exerting themselves. And this lump typically gets bigger when they strain, and it gets smaller or sometimes completely goes away as soon as the patient relaxes or goes into the lying position. Now, these are some of the symptoms. There are also patients who remain entirely symptom-free. We call them as asymptomatic hernias. And the kind of treatment that these kind of patients with asymptomatic hernias require is something that needs to be decided after a full and a frank discussion with the doctor. But if they are symptomatic, they definitely require treatment. As far as treatment for hernia is concerned, there are no medications or injections that can be given to treat a hernia. The treatment of hernia is only surgical. It could be either an open surgical procedure or a laparoscopic surgical procedure. Again, the choice of the procedure will be decided by your surgeon after a discussion with yourself. Lots of factors are taken into consideration when that decision is made. Factors such as age of the patient, fitness level of the patient, size of the hernia, location of the hernia, and of course the expertise of the surgeon and the availability and the infrastructure of the hospital. Up until the mid-80s, late 80s, open surgery was done by simply suturing and closing the defect which actually caused the problem, and patients had a lot of pain because of this procedure, and the recurrence rate was also quite high. In the late 80s, mesh repair of hernias became quite popular. Basically what it means is a plastic material, we call it as mesh, is placed over the defect, and it is firmly secured in that area. As a result of this, the recurrence rates have gone down quite significantly. Not only that, the amount of pain that the patient experienced after this operation was also quite low, because this is regarded as a tension-free repair. So the sutures, the tissues are not really pulled and stitched together. Rather, the mesh is placed on top of the tissues, and so the amount of tension that is in that area is reduced, and therefore the pain is also less. A few years later, another innovation came up in the field of hernia surgery, and that's laparoscopic hernia surgery. And now that's become extremely popular. largely because the amount of pain that the patient experiences after this procedure is even lower. And the infection rates are also quite low. Having said that, the recurrence rate for both laparoscopic surgery and open surgery, if done in expert centers, in experienced hands, is similar. The advantages of laparoscopic surgery are that a patient is able to get up and walk soon after surgery. The pain levels are low, and therefore they can get back to their normal activities, they can get back to work early, and the overall experience is quite good. There are a number of types of laparoscopic surgery. As we get better in surgical technology, and as we get experienced in the field of laparoscopic surgery, there are more and more innovations coming up, all for the benefit of the patients. In summary, I would like to say that hernia is such a common condition. It can cause symptoms. It can affect everyone. It can affect men, women. It can affect people of all age groups. And if you develop problems related to hernia, it's quite important that you seek expert help and advice, because in this day and age, there are excellent treatment modalities available for hernias.